Hey folks, Dr. Joe Esposito here. I am so glad that you're here today. We're going to talk today about determining if you have anxiety. Now, last week we did a show on the immune system. How do you know if you have a challenge or a weakened immune system? Very popular topic, because a lot of times you may have these symptoms, you don't know what it is. You say, oh my gosh, I have this, I have that. Well, maybe it's an immune issue. Same thing with anxiety. A lot of people suffer from clinical or maybe because subclinical anxiety, where it's not totally ruling your life, but it's something we have to address. So we're going to talk the first part of the show about anxiety, and then the second part of the show, we're going to talk about nightmares, which kind of ties in together. Because sleep is a big issue. We have a lot of patients come to us with sleep issues, and they don't know what to do about it. And so we're going to kind of tie in the anxiety, the nightmares, and the sleep all together. So I've been seeing a lot of patients in the past year that have anxiety. And may have to do with COVID. It may have to do with their personal lives. But how do you know if you actually have anxiety? Patients come in with some symptoms, and I go over it with them, and I said, well, maybe it's a lifestyle issue. And when we explain it to them, it makes sense. And one of the things we see a lot of, my doctors and I, we see rapid heart rate. A lot of people come to see us, and they have anxiety, and one of the symptoms they have is rapid heart rate. Now, rapid heart rate can be caused by a lot of different things. I get this question probably once or twice a week on the website, drjoe.com. Now, if you hear a sudden noise, you get scared, it sounds like a gunshot or something like that. Your body releases stress hormones like adrenaline, noradrenaline, norepinephrine, cortisol, and it makes your heart beat harder. You may feel like it's beating unevenly. That's called a palpitation. So you have increased heart rate, and if it's uneven, that's an issue too. Over time, it may just go away. It's no big deal. You're just stressed out for the day, for a week, whatever it is. But when you start to see it over a long period of time, it can raise your blood pressure. It can lead to heart disease, hardening the arteries, high cholesterol, and even a heart attack. So if you have rapid heart rate, it could be several different things. One could be anxiety, like we just talked about. So we always want to try to find out what's causing the anxiety. Is it a structural issue? Is it physical? Are you in pain? If you're in pain, it can cause anxiety. Is it a nutritional deficiency? Many times there's a nutritional deficiency involved. You just don't have the right nutrients to make the body work. It could be a digestive issue. Your digestive system is controlled by this big nerve called the vagus nerve. And it comes out of the left side of your body and controls the digestive system. And it's what's called a parasympathetic control mechanism. I'll talk about that in a little bit. So if the vagus nerve is being irritated because you have digestive issues, acid reflux, heartburn, constipation, maybe a disease, Crohn's, colitis, irritable bowel, that can affect the vagus nerve. And the vagus nerve has an impact on your heart, and that can actually cause rapid heart rate. And there have been countless patients over the years that I've seen, and my staff of doctors have seen, where they have acid reflux or heartburn. And we can take the stomach, which is now pushed up into the diaphragm, and gently pull it down away from the diaphragm. That relaxes the stomach, which takes the stress off the vagus nerve. And in most cases, if that's the cause, the heart rate returns to normal. And the reason I know so much about this is I had that condition for decades. I remember being a kid. One of the earliest memories I have of being alive is laying in my bed in Hoboken, New Jersey, in Willow Avenue, and feeling my heart just going boom, 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 and then it would brrr, and then it would stop, and then it would back again. I thought it was normal. I didn't know that wasn't what your heart was supposed to do. And so years later, I finally got my degrees, and I was seeing a patient, I remember, in the second adjusting room in my office. And this light bulb came on in my head. Maybe I'm irritating the vagus nerve with all this burping and bad breath and bloating. And I had one of my doctors pull my stomach away from my diaphragm. And for the first time in my life, I had no stomach pain. I always had some or more. And also, if the digestive system isn't working, it can lead to anxiety as well. We're going to talk about that in a little bit. So rapid heart rate could be due to several things. It could be an effect of anxiety, or pinched nerves can affect it, acid reflux, heartburn, irritable bowel syndrome affecting the vagus nerve. That can cause it too. But then we got to get to the cause of that, because that can cause anxiety, which can cause more issues as well. So how about rapid breathing? Sometimes people, I see patients like that all the time. Now, if you're in pain, you're going to have rapid breathing. It's very common, but it could be due to anxiety. Now, anxiety is caused by the body just not shifting from what we call sympathetic into parasympathetic. So there's two types of nerves in your body. Sympathetic nerves speed you up. Parasympathetic nerves slow you down. And all day, every day, you're shifting back and forth between sympathetic and parasympathetic. If you're stuck in the sympathetic mode, we call it. You're always anxious. You're always riled up. Your heart races. You're not sleeping properly. You're angry a lot. That's what we call sympathetic dominance. And what we need to do is shift you from the sympathetic dominance, or the speed up nerves, into the parasympathetic, or the slow down nerves. So if you're anxious, you get excited, which kicks you in sympathetics, which keeps you anxious, which kicks you back into sympathetic. So getting to the cause of the anxiety is the key. And in my experience, it's always related to either chemical, physical, or emotional issues. And if we can fix those issues, many times that solves the problem. I can't fix many of the emotional issues or the stressors outside your life. I can't fix the fact you lost your job. I can't fix the fact you broke up with your spouse. I can't fix the fact you don't like your boss. But if we can fix the physical and the chemical in your body, and those are the easy ones to fix, many times you're able to deal with the emotional so much better. And so when patients come in for chiropractic care, stomach adjustments, nutrition evaluations, we have a pain clinic as well here in our office, so we can do injections, we can do medications, and we get the person out of that sympathetic, crazy pain mode. Many times the anxiety is resolved. And so a lot of these symptoms that you're having, you got to start thinking, why do I have them? And that's what we always do. We always try to find out why. I don't want to treat your symptoms. I want to treat the cause. And that's what we're always trying to get at. So rapid breathing could be an issue. Now, it could be a sign of asthma, lung disease, chronic obstructive pulmonary disease, what's called COPD, other conditions. But again, my doctors and I, we're Sherlock Holmes of healthcare. We investigate. We try to find clues and then put the puzzle together and try to find out where your problem's coming from. Every day, we have offices in Marietta, Duluth, Stockbridge, and West Cobb. Every day, patients come in and say, my doctors are stumped. Nobody can figure out what's wrong with me. And then we sit down with them and we do an analysis. And many times we find it's either chemical, physical, or emotional. And if we fix those the two of the three anyway, a lot of that anxiety is going to go away. So the parasympathetic sympathetic is called the fight or flight response. Your fight, a fight, okay, somebody comes in a room and starts screaming. You're ready to protect yourself. Your fight triggers certain hormones that send signals to your brain, your spinal cord, and your nerves. Your blood and glucose, which is the fuel the body uses for energy, floods into your arms and your legs, and it prepares you to fight or flight, run. So your body's ready to take on whatever is attacking you. Your pulse speeds up, your breath speeds up, you get shaky, you get sweaty. That's okay periodically. That's designed to keep you alive. But if you're always like that, that's when we have to say something's wrong. You're stuck in that sympathetic mode, and we got to downshift it. So chiropractic, very good for shifting to the parasympathetic mode. Massage might work. Fixing the stomach might work. Staying away from stimulants, coffee, tea, chocolate, drugs. There are certain drugs we're going to talk about that can cause this. So we always want to find out why your body is malfunctioning. If we can find out why, it's very easy to fix. In most cases, not always, but most. Tense muscles. Again, as a chiropractor, we see a lot of people with tense muscles. And so what we want to do is get them to relax. And so chiropractic is good for that. Massage, we talked about that. Many times it's just that you don't have enough water in your diet. Most people are dehydrated. You're just not drinking enough water. And I always make the analogy that your muscle is like a sponge and that it holds water and it's nice and soft and pliable. But if it starts to dry out, it gets tighter and less flexible. So one of the simplest things you can do is make sure you're drinking enough water. Now, some people say, I don't like water. Okay, add a little lemon juice to it. Add some lemon juice and stevia to it. How about some herbal teas? You can make herbal iced tea as well. I drink slippery elm tea whenever I'm on the air, whenever I'm doing lectures, whenever I'm doing talks or TV shows, because the slippery elm gently coats my throat and it keeps my vocal cords smooth. And I've learned if I don't have my slippery elm tea, after an hour or two of talking, I start to struggle a little bit. Keep my slippery elm next to me, things are great. Now, you can make it iced if you want to in the summertime. Add a little stevia to it if you want to. Licorice tea might help with digestion. So there's all sorts of different teas that have medicinal benefits, but also taste pretty good too. So you can kind of decide, pick and choose what you like. You can try going to a place that has loose tea and maybe try a little bit of each and say, okay, I like chamomile, or I like a lemon balm, or I like a slippery elm, and try different things that way too. Otherwise, you'll end up like a lot of people, and you'll have a box of tea, and you take 2 tea bags out of it, and then you buy another box, and you open up the cabinet, and you're full of tea boxes. Anybody like that? Yeah, I don't do that because I drink a lot of tea, so I don't store them up. So we're talking about signs and symptoms of anxiety. How do you know if you're suffering from anxiety? And that's what we're talking about today. So tense muscles could be one of the things, and that could lead to headaches, migraines. You can do yoga. You can do breathing techniques, meditation. All that's good. But most times there's something physical going on. It's a pinched nerve. So if you have neck pain, back pain, shoulder pain, numbness, tingling, headaches, chances are you have a pinched nerve. And chiropractic studies have shown overall is the most effective, least expensive treatment for back pain. So why wouldn't you start out with the most effective, least expensive treatment? Makes no sense to me. If you don't, I had a patient just the other day, and she said, I'm scheduled for hip surgery, and I don't know if I should have the surgery. I took her x-rays. Her hips look fine, and her sacrum was out of place. Her tailbone was twisted. And I touched the sacrum, and I said, this nerve goes right into here? And she said, yes. I said, listen, I'm not here to tell you to have surgery or not have surgery. If you need surgery, absolutely, I'll get you an Uber. I'll drive you over there. But let's try this first. And if it works, great. If chiropractic works, PRP works, kind of escalation of care, maybe some medications, maybe some supplements. Let's see if we can get this under control. If we can't, we always have the option to have surgery. And she looked at me, she goes, well, no one ever gave me any options. The doctor just said, let's just jump in and do surgery. I said, give me 6 weeks. If it doesn't work, you can have surgery in the 7th week. How about that? And she started crying, and she said, oh my God, yes, that's exactly what I want. So again, she just started treatment. We'll see how she does. But my track record is really good when it comes to this stuff, and I'm pretty sure she's not going to need the surgery. We send people out for surgery periodically if they need it, but most times we can fix it without. Again, I'm not against surgery. So we're talking today about signs and symptoms of anxiety. I got a little off track there. High blood sugar. If you're anxious all the time, your body needs to have fuel. So normally your body gathers up and stores extra sugar. It stores it in glycogen, which is stored in muscles and in the liver. And once all the glycogen stores are filled up, it's stored as fat. So you're storing energy. That's what fat is called now, energy. You can't call it calories anymore. It's called how much energy does something have? Nah, it's how many calories it has. So it'll store calories or energy, and then it'll utilize it. But if you're always under stress, the body has to be converting fuel into glucose so that your body can use it as for energy. Over time, you're putting all this glucose into the blood sugar can go up. And if you have too much blood sugar, your cells become resistant to sugar. Follow me on this. I'll try to give you a quick explanation of what is called type 2 diabetes. You have too much sugar in your blood. You eat too much sugar. You're under stress all the time. Your body releases insulin, and the insulin goes into the cells and acts like a key, opens up the cell and allows glucose into the cell to be used as energy. It's like filling up your fuel tank. That works perfectly when the body is working normally. If you have too much sugar, then the body releases too much insulin. And the cells can't take any more sugar. The insulin goes up to the cell, opens it up, and lets sugar in. Well, eventually the cells say, listen, I can't take any more sugar. It's going to gunk up the works. I'm not able to use it fast enough. So the cells resist insulin. They say to insulin, no, I'm not going to let you open me up and let sugar in. So now the cells become insulin resistant. Insulin resistance is also called type 2 diabetes. So if you're under stress for a long period of time, that could raise your blood sugar, and that can affect heart disease, stroke, kidney disease. So stress can adversely affect you long-term in many different ways. When you're under stress, your adrenal glands produce something called cortisol. Cortisol is the stress hormone. Now, cortisol short-term is very, very helpful. Keeps you alive. When you're under stress long-term, whether it's pain, emotional stress, digestive stress, nutritional stress, your body can't utilize all the sugar. Cortisol is released. Cortisol stores sugar as fat. So when you're under stress, cortisol causes you to lay down fat. Fat then increases your stress, which increases your cortisol. There have been times in my life, stressful times in my life, where I've had my blood work done and my triglycerides are very high. Now, triglycerides are how the body stores fat. Glucose is used. Once glucose is all filled up, it's converted to glycogen. Once glycogen stores are all filled up, it's converted into triglycerides. and triglycerides then get stored as fat. And so if you have high triglycerides, that's usually a sign that A, you're eating way too many carbohydrates, or B, you're under a lot of stress. And in my case, I've been vegan now for 35 years. I don't eat a lot of junk. It was stress. And so I can measure my cortisol levels for stress. I can measure my triglyceride levels sometimes for stress. But if I see these things are high, I then have to say, okay, I got to do some soul searching. How do I bring down my stress levels? So there's blood work to determine if you have stress or not. But a lot of times you just have these symptoms and you know where it's coming from. So if you have high blood sugar, it could be diabetes, but it could also be stress. So that could be an issue. How about trouble sleeping? If you have trouble sleeping, that could be a problem. I don't know if you're like me, but sometimes I'll lay in bed at night and say, okay, did I do this? Did I make this phone call? I have notepads, little sticky notepads, and I have them everywhere in my house. I have them in the studio with me. I have them in my car. I have them in my bedroom. I have them in my kitchen. And so whenever I have a thought, I write the thought down. Because otherwise, it just dwells in my head, and I can't get that out of my head. Then I can't sleep, and that can lead to stress. And then if I'm stressed out, I can't sleep. So the technique that I use is I have to write things down. Now, I don't like putting my phone next to my bed because your phone has electromagnetic frequencies, and that's a whole nother lecture. So I put my phone way across the room. So if I wake up, I just have good old-fashioned pen and paper. I'll scribble stuff down. Many times, I can't read it. Cannot tell you how many times I'll wake up in the morning, look at my pad, and go, I have no idea. And I'll leave it. I'll put it on my desk for a couple of days, and sometimes, oh, that's what it said. Call Garrett or whatever it was. So it'll come back. If not, I just throw it away. It was, a wasted thought. But sleep problems many times can be due to anxiety. Now, sleep problems can also be due to the stomach pushing up against the diaphragm. Because if the stomach is pushed up against the diaphragm, your diaphragm can't drop down, so you can't breathe. And so that can lead to sleep apnea, snoring. So many times when we fix the stomach, we actually pull the stomach away from the diaphragm. That solves sleep issues and sleep apnea issues and snoring issues. And I can't tell you how many people over the years have thanked us because their spouse doesn't snore anymore. Or you can sleep and you have better energy and you're better at your relationships, you're better at work. So getting to the cause of the problem is always the key. So if you have a health issue, if you have neck pain, back pain, shoulder pain, numbness, tingling, headaches, sleep problems, anxiety, digestive issues, come see us. Stop suffering needlessly. The biggest complaint I get it every day, not every day, every hour. Why didn't I do this sooner? Dr. Joe, I've been listening to you for 5 years, 10 years, 20 years. I've been lecturing now for about 40 years. So I have people some way back when sometimes. And they'll say, I heard you speak 35 years ago. You were brilliant. And I've been always meaning to come see you. 35 years? You waited 35 years to come see us? And when they do, they say, why didn't I do this sooner? So if you have a health issue, you can make an appointment to come see us right on our website, drjoe.com. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. The initial visit was $375. We've reduced it to $249. We just raised it, by the way, folks, because we couldn't do that forever. So it's $249. It's an exam, x-rays, consultation, going over the x-rays, and a complete nutritional evaluation. So one adjustment and then 2 visits included in that. Nutrition alone is $150. So if you want to get well, just go to our website, drjoe.com, book the appointment. You can do it right online. We'll call you, confirm it. Very easy. We accept almost all insurances, car accidents, sports injuries. And I say it every show, if you're ever in a car accident, if the car was damaged, you were damaged 100% of the time. So please, I'm begging you, don't wait. If you have a health issue, stop waiting. The longer you wait, chances are the worse it's going to get. And then it's a little harder to fix. It's a lot more expensive to fix. And usually my team is pretty good at getting to it, but sometimes it goes too far. And we're able to stabilize it, but we may not be able to fix it. So if you want to make an appointment, drjoe.com. Do it right now. Don't waste time. And we will see you hopefully next week then. Other signs that you have anxiety. That's what we're talking about, signs of anxiety. You get sick all the time. Now, last week we did a show on the immune system. And if the immune system is weak, it could be due to the fact that you're anxious all the time, releasing cortisol. And cortisol can weaken the immune system. So if you're sick all the time, it could be an anxiety issue. And so if you have irritable bowel syndrome, acid reflux, heartburn, burping, gas, bloating, diarrhea, constipation, it goes back to that whole sympathetic, parasympathetic thing we talked about. Sympathetic nerves speed you up. parasympathetic nerves slow you down, and you're not able to shift into the parasympathetic mode. Sometimes it's a pinched nerve in the spine. Sometimes it's a spasm in the digestive system. Sometimes it's the fact that you don't digest wheat very well or dairy products. And so I always say the 2 foods I want you to try giving up right away are wheat and dairy. And you got to do it for about 2 weeks and see what happens. And chances are you'll be very happy with it. So digestive issues many, many times are related to anxiety issues. How about romantic issues? For men, if we're going to function in a romantic mode, we'll try to keep this clean. If we're going to function, we have to be in what's called the parasympathetic mode. Parasympathetic mode allows us to function romantically. For women, same thing. If you're stressed out, chances are romance is not on your top of your list. And it certainly wouldn't be as pleasurable because you're in the sympathetic mode, that stressed out mode. So for men, many times if we fix their stressor, it's a pinched nerve, it's digestion, it's nutritional, the body's able to deal with the outside anxiety or stresses better, brings them down from the sympathetic into the parasympathetic mode, and then they're able to function. Now, I had a patient yesterday, and he's in his mid-50s, and he says, Doc, I really don't have any interest in romance anymore. He says, and I don't think I function as well as I used to. So sometimes it's a pinched nerve, sometimes it's nutrition. Best supplements everybody should be taking anyway, I feel, Dr. Joe's Super Greens and Dr. Joe's Essential Source. That's the minimum supplements everybody should be taking every day. If you're not doing anything else for your health, please at least try Super Greens and Essential Source. They're on the website, drjoe.com. We have another supplement called nitric oxide, and that opens up your blood vessels. So many times, combination of chiropractic care, stress reduction, fixing the digestive system, Super Greens, Essential Source, and nitric oxide, men and women are able to start to return to normal romantic function, which is kind of cool. We also have a next step, if you need it. It's called PRP. It's called an injection. And you can inject PRP, your own stem cells, or not your stem cells, I'm sorry, your platelets into the sex organs for men and women. And many times it revitalizes the organ. And I can't tell you how many men have been thrilled with that because it stimulates new growth, new vascularity, new blood vessels, and it's your own cells. So it's not like we're taking a pill or a drug or anything like that. And it's way less expensive than a lot of the drugs as well, too. So that might be something you might want to consider. You can go to the website, drjoe.com, look under PRP, and you can make an appointment to come see us. We'd love to have that option. And for women, if you cough and sneeze a lot and you pee yourself, many times the PRP will help tighten everything up as well. So we're talking about anxiety today, and anxiety or stress can lead to these issues. And of course, digestive issues are a big one. Weight gain, we talked about that, laying down fat. But irritable bowel syndrome, gas, bloating, diarrhea, celiac, so easy to manage. All you have to do is not eat wheat, barley, and rye. And I've had patients fight me on this. No, I like wheat, barley, and rye. Well, then you're going to have diarrhea every day for the rest of your life. You're not going to absorb your nutrients. You're going to have stress. So we got to fix the digestive system on our patients. Probably 85% of the patients we see, we have to work on your digestive system. So folks, if you have a health issue, neck pain, back pain, shoulder pain, you've ever been in a car accident, workers' comp injury, digestive issues, nutritional issues, just come see us. We have offices in Marietta, Duluth, Stockbridge, and West Cobb. You can go to the website, drjoe.com, book an appointment. The initial visit used to be $375. We've reduced it to $249, and we'd love to have the opportunity to be your doctor. And we do accept most insurances as well, car accidents, sports injuries, Medicare. We want to be your doctors. We want to do everything we can to get you well and keep you well. Follow us on social media at Dr. Joe Esposito. Our podcast is Dr. Joe for the Health of It, or our website has all the podcasts on it as well. And we also have a Facebook group called Joe It Alls. We'd love to have you there too. I'm Dr. Joe Esposito, drjoe.com.